So welcome to this session for those of you who might be interested in the health professions, right? More specifically, the ones that have a more solid science foundation, right? If you think of yourself as being a future medical doctor, dentist, pharmacist, veterinarian, etc., this is the place you want to be. I am Dr. Elizabeth Pollock. I'm an associate professor of chemistry and biochemistry. I'm also currently serving as the pre-med advisor for students in the School of Natural and Mathematical Sciences. You would have probably already watched the video from our dean on why Stockton is a particularly good choice for your undergraduate career, right? We're an undergraduate-focused institution with a lot of various pre-professional programs, an emphasis on the liberal arts and a broader education than just the sciences, which is something that medical and dental schools and like all really value. And so you want to be able to take courses outside just sort of the core courses that you would need for any of those programs. To give a sense of how do you get where you think you want to go, right? So you think you want to be a future medical doctor, for example, right? The traditional path is to get your undergraduate degree, right? Your 4-year bachelor's degree. Most common majors for people who go into any of these programs are biochemistry, molecular biology, and biology, where we have a pre-professional track, which is really just a way to make sure that you know exactly what courses med school is going to look for, right? But the reality is none of those professional programs care what your undergraduate major is, right? You can major in art history if you really want to, right? Provided you take the courses that they need you to take, right? And as long as you take the necessary undergraduate prereqs, then your major can be anything, right? Biology and biochemistry and molecular biology are the most common majors only because those do the most comprehensive job of including in the major all of the courses that serve as the prerequisites for those advanced degrees, right? Not because you actually need to have those and any of those majors. If you major in something else, and even if you major in biology or biochemistry, right, the most important thing is that you succeed in a challenging curriculum, right? That you get involved in things, right? Those are the things that medical schools, dental schools, et cetera, are all going to care about, right? And so that matters far more than the actual major that you choose. General sense of what the overall curriculum looks like at Stockton, right? Where the curriculum is, you can get 1 or 2 degrees in the traditional undergraduate curriculum, right? You can get the Bachelor's of Science or the Bachelor's of Art. The only difference between them is how many science courses you take versus how many non-science courses you take. I'd say that most pre-professional people end up getting the Bachelor's of Science just because by the time they meet the required courses for medical schools, they're close. But you can certainly get a Bachelor's of Arts if your interest lies not just in the sciences, but in other things as well, right? And so in a Bachelor's of Science, about 2/3 of your curriculum is going to be courses in your major or closely related to your major, right? And so, for example, if you're a biochem molecular biology major, then any chemistry or biology courses are all in your major. Physics, the math that you need as part of that major are what we call cognates, right? They're very closely related to your major, they're required for your major, but they're not themselves chemistry or biology courses. And then the remaining 1/3 or so of your curriculum are general education courses, right? So these are your liberal arts distribution. If you opt for the Bachelor's of Arts, then it's half and half, right? And so you only have to take half of your courses as science courses and the other half as general education courses. If you were interested in majoring in something outside of the sciences and still wanted to go to medical school, then a Bachelor's of Arts in that other major would probably be really quite appropriate, right? Because the 64 credits that are available for general education would allow you to fit in some of those science prereqs that you would need for medical school and the like. And then some specific options, right, in terms of not following the more traditional path of first earning your bachelor's degree and then going on and applying for medical school, dental school, et cetera, right? We do have a few dual degree options in the health fields. You can get your pharmacy degree, your PharmD with Rutgers, where you spend the first 2 to 3 years here at Stockton doing sort of the lower level courses, right, to your intermediate courses, right? And so you can take general chemistry, your biology, your biochemistry in class sizes that are normal size, right, from my perspective, right, smaller than what you'd have at a very large institution like Rutgers. And then you go on to Rutgers after 2 to 3 years, finish your curriculum up there, transferring back a couple of those courses to allow you to finish the Bachelor's of Science here at Stockton. We also have an articulation agreement with Rowan's Medical School, right? And so you'll finish with your Bachelor's of Science from Stockton and your DO from Rowan's Medical School. For any of these programs, you have to get accepted into them as an incoming freshman. Right? You can't try and join the program after you already get here. You have to get accepted into it, right? Because you have to get accepted not just by us, but you also have to get accepted by Rutgers Pharmacy Program or the Rowan Medical School to be part of that program. Right? The application deadline for that is November 15th, I believe. Right? And so if this is something that you think you find interesting, make sure that you go and you look at the application site on Stockton's website, because you need to make that decision fairly early in the game of as you're applying to colleges and university. And while you're in the program, you can still end up changing your mind, right? You can decide, actually, maybe I don't really want to do pharmacy, maybe I don't want to do medical school. And since you're in the process of earning a Bachelor's of Science in either biology or biochemistry, molecular biology, it's easy to just switch to that as a major. And you also, of course, have to stay in good standing with that professional program, right? And so you're not going to be able to get anything below a B in any of your science courses. And for the dual degree option for medical school, you have to get an adequate score on the MCAT as well. And if you don't live up to those obligations, then you won't be allowed to transition over to that advanced degree. You'd instead end up falling back and just finishing your Bachelor's of Science here at Stockton. And so it gives you a little bit of flexibility, right? It gives you the peace of mind to know that you have a spot, but it's medical schools, right? You can't blow it off and expect to keep that spot. And then a couple of other things, right, in terms of why Stockton is a good choice, mostly because unlike, especially Rutgers, at Rutgers, you're going to have very large class sizes. The odds that you're going to have graduate TAs and teaching assistants for a number of your courses is really quite high. We don't have that here at Stockton because we don't have graduate programs in biology or in chemistry. And so you're going to be taught by your faculty themselves, right? Class sizes are really quite small, right? We don't have more than about 40 students in lecture. Labs are capped at 20. And then upper level labs will actually get even smaller. We don't have a ton of adjuncts even, right? We have some, but most of them are teaching labs, not lectures. And many of them are actually professionals in the field, right? And so the adjuncts who teach chemistry labs are mostly actually people who work as chemists and then just choose to teach one night a week, right? And so are very vested in student education. And then the other reason to choose a place like Stockton, right? And so if you're a chem or a biochem molecular biology major, you're required to do a research project as part of your undergraduate curriculum. If you're in one of the dual degree programs, you wouldn't be required to do that. But if you're in a traditional 4-year undergraduate program, that's an expectation for the major. If you opt for biology or some other major, you're still welcome to do research. You're just not required to do research if you're a biology major. However, research does gain you some valuable experience if you want to go to med school, if you want to go on to dental schools, et cetera, right? Because it shows that you can work independently. It shows that you have sort of explored things in a bit more depth than you can just in your labs. And of course, it does a much better job of mimicking what science really is than any coursework possibly could, right? Because in the lab that's associated with a course, we're usually trying to teach you the technical skills that are needed for success in that area. But that's not the same thing as doing science, right? In science, you don't already know the answer. And that's why doing research can really be quite fun, honestly. And we make it very approachable for undergraduates to get involved in research, right? You can even get involved in research in your first year here, right? Many of us are happy to take students right from the very beginning of their time at Stockton, right? Or you can choose to get involved later, right? And unlike at a larger institution like Rutgers, right? At Rutgers, you're not going to ever touch the instrumentation, right? You're going to hand your sample off to a TA, to an instrumental technician, and they're going to run your samples for you. Here, you're going to have to run the samples yourself. And so you get direct hands-on experience with the instrumentation, with doing all of the aspects that are really what science is all about. Right? And so to me, that's actually something that you should prioritize no matter what your decision ends up being in terms of where you think is the best choice for you for your undergraduate career. Is you should always be thinking in terms of, well, can I get involved in doing any sort of research, right? And if the answer is no, then you should pause and consider whether that's an appropriate place for you, right? Here, the answer is yes. And that, I think, is one of the strengths that we bring. The other things that we sort of bring to the table and make Stockton a nice choice, right? A lot of this I've already mentioned, right? That we have small class sizes. You can work directly with your faculty on a senior project. You can, of course, study abroad. If you want to study abroad in the articulation agreements, you wouldn't be able to do that, right? Because you have to finish all your core courses too quickly. But if you want to do a traditional 4-year undergraduate degree before you go on to med school, vet school, whatever, as long as you plan carefully, you can absolutely do a study abroad program. The honors program is always very popular with students like you guys, right, who are very academically focused, very driven. And that's something you'd want to apply to as you're coming into Stockton. And then, of course, we have a number of student clubs that are sort of focused on the health sciences aspect side of things to create sort of a network and support community among your fellow students. And so that's sort of my quick overview of why Stockton. I don't know if there are a ton of people in the session live, but if you have any questions, I'd be happy to try and answer them.
Hello. Can you hear me? Oh, hi. My name is Aileen, and I was wondering, since, like, due to the whole pandemic, like, and I know the school is, like, test optional, but for certain majors, it's not. Is that true?
It is, sort of, right? We need some sort of test, right? It can be the SAT, or you can take what's known as the AccuPlacer, right, which we administer here on campus.
Oh.
Right? And there are probably other places you could do it, because it's not so much you need it for admission as you need it to sort of make sure that you're ready to succeed in those courses, right? And so, like, you can't start taking chemistry until we know that you have the mathematical foundation to succeed in it.
Okay. So, like, how would, like, the dual degree program work for, like, the pre-med course?
So if you were to try and apply for the dual degree with Rowan Medical School, right, there's an application packet on the NAMS website to apply for that, right? And so really what you end up doing is you spend your first 3 years here at Stockton taking sort of the core courses, right? So you'll get all that chemistry, biology, all the physics done, right? And you'll be going even faster through the curriculum than you would be if you were trying to do it in 4 years, right? Because you need to get all of the prereqs done in 3 years instead and get them done in time to study and do effective on the MCATs, right? But then you get to take 1 year less overall in terms of your education, right? Because your 4th year is going to would be at Rowan Medical School, and we'd use those courses in your first year of med school. We'd sort of count them also towards your undergraduate Bachelor's of Science degree. right? And so
Okay.
they'd sort of double count as your first year of med school and your last year of undergraduate.
Do you know when would I start applying? Because right now I'm a high school junior.
Yes. So the application for those dual enrollment programs is due no later than November 15th.
Of this year.
Yes, because you're a rising junior or a rising senior?
I'm a rising senior.
Okay, yeah. So by November 15th of your senior year, you'd want to put in that application. Actually, I'm going to put up real quick for you the website of where the application is. Right, and so here's where you'd want to go to find information about that dual degree program. Right, and so if you just go to the NAMS homepage, I think I just search for health professions whenever I do this. It'll bring you to the dual degree programs, and you can apply through this application process, right? And so this would be, actually that's for a different thing, right? But through this website, you can see the application process for getting into that dual degree program, right? Because you'd want this specialty application.
Okay, thank you. Yeah, because I don't know what to do because the SATs and all, and I have to take it. So I'm not sure what to do. And plus, since like the SATs right now, they're only getting hosted. Yeah, they're only getting hosted in certain schools, and like all the schools are far from me. They're not hosted in my main school.
Right. Let's check and see if this needs. Stockton needs your scores not to get into things, but before you start classes.
Okay.
Right, because it's basically we use the scores as a placement aspect, right, to place you into the correct level of math. Right. Okay. And so if you didn't have them done before you were ready to apply, that wouldn't necessarily be a problem.
Okay, so I could still apply?
Yes.
Okay.
Right. Now, what I don't know is whether or not Rowan's DO program would be willing to waive any of that side of things. Right, because you have to get in, right? So if you wanted to do this dual degree accelerated program, you have to apply both to us and to Rowan.
Okay.
Get into both, and then you can do this, right? And so Stockton would be okay with, take the AccuPlacer when you get here to get placed into the appropriate, to make sure that you're ready. Rowan may or may not be.
Okay.
Are you in AP Math or anything?
I'm in AP Bio.
Okay, but you're not planning on taking Calc in the fall?
I'm taking Honors Calc next year.
Okay.
Yeah.
And so Honors Calc won't get you ready to take the AP test, right?
Mm-hmm.
Or will that get you ready for the AB?
No.
Okay.
That's
what I'm thinking, but
yeah.
Different schools call things different things. But it does suggest that you would be able to do well enough on the SATs to get the scores that would let you take the chemistry right away, right? Because you wouldn't be able to succeed in a program like this unless you could start the chemistry and the biology right away. And to be able to do that, you basically need to be able to start with calculus, right? And so equivalency wise, that's like a 610-ish on the SAT math. It changes every once in a while, but the fact you're taking Honors Calc suggests you'd probably be okay.
Yeah, because for my senior year, I'm gonna take organic chem because I just wanna, have like at least like a bit of foundation.
Right.
Yeah.
Right, and you've already finished the other chemistry?
Yeah, I already did chemistry my sophomore year.
So yeah, I'd say look and see if Rowan would let you apply without the test, right? Because it doesn't look like we'd require it before you apply to this.
Okay. So I have to go there first?
You'd start your undergraduate career here, but you need to...
No, I meant like for like the website, like I have to go to them first?
Yes, right.
Okay.
Because you need to get into both programs to be able to do this. And so I'm looking to see if
So applications already started?
you can turn this in kind of whenever, right? I'm not going to be reviewing applications until the fall, but make sure you don't miss the deadline because November 16th, I'm not looking anymore. And admissions would also be able to sort of help you navigate how do I make sure that Rowan knows that I've applied to do this, right? And how do we communicate between the two of us if you were to get into both schools? They handle that kind of paperwork, the tedious stuff. Any other questions?
Oh, no. Thank you for clearing it up because I was like so unsure on how to do it.
Yeah, and it's so much harder right now for you to decide what is the best option.
Yeah.
Right? Because you can't predict when you might be able to take the SATs and how important places like Rowan will consider them these days, right?
Yeah, it's so hard.
A little flexible, but we can't go completely flexible. And so
yeah, and if I don't get into the dual degree, can I still apply for biology or it's just
right. And so if you get into just Stockton and not the dual degree, then you're just going the med school route that most people do, right? Most people get their undergraduate degree and then transfer to and then go to a medical school.
Oh, okay.
Right. That's the far and away the more common path. And so worst case scenario, that's what you end up doing, right? But that's what almost everybody does. The dual is just nice because it shaves a year off the time.
Yeah. If I have any questions, do you think I could email you?
Of course.
Okay.
Right. And so, it shows my name, right? And so emails at Stockton are really easy. So my email is just elizabeth.pollock@stockton.edu.